Well, good afternoon, beautiful people. My name is Dr. Angeles Alexander Martin, or Dr. A for short, and welcome to my channel. I am the CEO of Pro Health Services, and my mission is enhancing your health and wellness to improve your quality of life to help you look and feel your best on the inside and out. I'm here today to discuss the link between weight and heart disease because it is National Heart Health Month. So, what is the number one killer in America? Heart disease. Which gender is more likely to die of heart disease? Women. What are the risk factors for heart disease? High blood pressure, type 2 diabetes, high cholesterol, cigarette smoking, family history of early heart disease, and getting older. So, of the first three, high blood pressure, type 2 diabetes, and high cholesterol, what do they all have in common? They are all complications of obesity. So, what is obesity? Well, when we talk about obesity, we classically talk about BMI, which is really a measurement. It's a calculation. It's not very accurate. It looks at the height and the weight, but the reality is that it doesn't really talk about what's going on inside the body. It's just raw numbers that insurance companies use to calculate or determine if someone has obesity. But the reality is, if you have 30 pounds on your body, more than what you need, you probably have obesity. So, how common is obesity? Well, if you look to the person to your right and you look to the person to your left and you look at the person behind you and you look at the imaginary mirror in front of you, statistically speaking, three of the four people you just saw have obesity. And that's right, approximately 75% of all American adults have overweight or obesity. So, why is this important? Well, it's important because studies show that by losing just 5 to 10% of your weight, you can greatly reduce the risk for high blood pressure, high cholesterol, type 2 diabetes, and the net result is greatly reducing your risk of obesity and thus reducing your risk of dying of the number one killer in America. So I help people along this journey. And I myself have never had a problem with weight per se, but I have had four babies. And with each of my pregnancies, I've gained 50 pounds. And with the first two pregnancies, it came off pretty easily. But for the last two pregnancies, it did not want to go away. The weight wanted to take up residence in me. So I had to go on a journey. I had to work hard at it. And I put myself on some of the programs that I myself prescribe. I was able to lose my baby weight. I've kept it off. I feel great. And when I had my breast mammo exam last year, there was no evidence of breast arterial calcification, i.e., no increased risk of cardiovascular disease. So, yay! I can speak from my own personal experience. So, again, when patients come to see me, there are four main areas that I try to address with them. The first is simply talking about their habits. In order to lose some weight, you've got to change your habits. There's a saying that says if you do what you've always done, you're going to get what you've always gotten. So I want patients to change some of what they do. One of the first habits I discuss is simply understanding the visual effect of food and knowing that just seeing food in and of itself makes us want to eat it. Therefore, out of sight, out of mind isn't necessarily a bad idea. Often, when I go out to eat, for instance, I will split a meal with my husband or I'll split a meal with my daughter because there's typically too much food there to begin with. And if you split a meal, you get fewer calories, it's better on your wallet. And again, that's a good, healthy habit. Another habit that I talk about is the importance of paying attention to nutrition labels, i.e., when you look at the label, know that there's serving sizes in there, knowing the calories that are in there, and knowing that there could be more than one serving in that container. For instance, when I was pregnant with one of my children, I ate a Stouffer's lasagna, and it was the extra meat one, and it was so good. And I ate it, and the cheese was good. And when I was done, I decided to flip it over, and I looked on the back, and uh-oh, there were 2.5 servings in there. And so instead of getting just one serving, I actually ate 660 calories, and that was not what I meant to do. So again, it just underscores that there can be more than one serving in a dish or in a package. So it's very important to take a look at that. Another thing that I talk about is the need for physical activity. And so there is both physical activity, exercise, and then there's also non-physical activity known as NEAT or non-exercise activity thermogenesis. And these are the things that we do when we move that's not necessarily exercise. So when we talk about exercise, it's recommended to have 150 minutes of moderate intensity physical activity every single week. And so I suggest simply walking around the block, 30 minutes, 5 days a week after dinner. That'll do it. But when you walk, it can't just be the slow walk. If you can sit there and you can sing while you're doing it, that's low intensity. You got to step it up. So instead, it should be intense enough where you can't sing, you can talk, but you can't sing. And that's moderate intensity. Then when we talk about non-exercise activity thermogenesis, I encourage people to try to get rid of the things that get rid of labor. So for instance, hide labor saving devices, i.e. the remote control. I know when I was a little girl growing up, if I wanted to change the channel, I had to get up and walk to the TV, click the button, turn the channel, whatever, and then walk and sit back down. But think about now, we sit there, we get the remote control, we start just scrolling through everything, we sprout roots on the couch. So we need to get moving. Speaking of moving, it's actually recommended that we increase our steps because the average US adult walks less than 5,000 steps a day, and that's considered sedentary. And sedentary lifestyles are bad for our health. So we want to increase our steps. So again, hiding the remote control is a good way. Another good way is knowing that the stairs are not our enemy. How many times do you see stairs and you start looking, where's the elevator? Where's the elevator? Trying to avoid the stairs. Well, the stairs are not our enemy. As a matter of fact, when I was in residency, we actually had a sign by the elevator that said, walk up one flight of stairs or walk down two flights of stairs, i.e., try to avoid the elevator. Now, if you're going up more than one flight or down more than two flights, or if you have a physical challenge for taking the stairs, by all means, take the elevator. But the idea is trying to figure out ways to keep yourself moving more. In addition, with regards to the exercise I mentioned earlier, if you have a chronic medical condition, I also suggest making sure you get cleared with your primary care physician prior to engaging in moderate intensity activity. So last but not least, after we talk about activity, we talk about nutrition. And that there is, we used to use the food pyramid to pay attention to our nutrition, but now we have the My Plate instead. So when you have your My Plate, if you took your plate, eyeball cutting that in half, half should be fruits and veggies, the other half should be grains and protein. And of the grains, half of the grains should be whole grains. I also, with regards to nutrition, mentioned there is no health benefit to pop. How many of us get empty calories from what we drink? And I've had so many patients who've lost weight simply by getting rid of the pop and eliminating those empty calories. So instead, guess what we need to drink? Water. It's recommended we have 6 to 8 glasses of water a day. So, I'm sorry, 8 glasses a day, 64 ounces. And so look at ways to increase your water intake and decrease your other beverage intake. So last but not least, I discussed the importance of seeing a doctor on your weight loss journey. You wouldn't see your hairstylist to take care of your blood pressure, would you? So why wouldn't you see a medical doctor to deal with the medical condition called obesity? Just like high blood pressure, obesity is also a medical condition. When patients come to see me, I have a special scale that monitors fat, muscle, and water. And that way we can make sure patients are losing weight safely. And that's very important. I had a patient recently who lost 7 pounds over the course of 2 weeks. And you would think that was a good thing, except only 1 pound was fat. The rest was water and muscle. And that's not healthy weight loss. But by just weighing them, I never would have known that. The only way we knew is by doing the body composition analysis. And so then we were able to make changes so that he could successfully lose the right thing. In addition, by seeing a weight loss specialist by myself, we can prescribe programs where you can lose weight faster than non-medical weight loss programs. I've had patients lose over 100 pounds in less than a year without medication on medical weight loss programs. In addition, with a senior physician, you can make sure your labs are checked. We do a physical exam. We also check labs. And as you get older, your metabolism decreases. As you hit menopause and andropause, your metabolism decreases. And what happens when you get older and hit menopause and andropause? Your hormones start to go down. And then other symptoms of hormone imbalance can be fatigue, irritability, insomnia, anxiety, depression, brain fog, to name a few. So by having the hormones checked, not only can they be optimized and you feel better, but it can also help improve your metabolism, which can facilitate weight loss. So, again, when we talk about coming in and seeing a doctor, last but not least, with making sure you're losing weight safely, I have several patients who do take medications. Not all of them do, but we make sure that they're not getting Ozempic face or Ozempic butt by monitoring, making sure that they're losing weight safely. So to conclude, with heart disease being the number one killer in America, and we know that risk factors for heart disease include high blood pressure, type 2 diabetes, high cholesterol, um, and these are all complications of obesity. So by being able to lose 10% of your weight, you can reduce those risk of complications and ultimately decrease the risk of heart disease, which is the number one killer in America. So my name is Dr. A again, and I'm taking new patients. So if you are looking for help on your weight loss journey, please feel free to give us a call or text at 614-442-2600 or go online to www.prohealthservices.org. So imagine for a moment if we worked together and we were able to help you lower your blood pressure, help your joints feel better, help you have more energy, help you feel better overall, help you fit in those clothes you haven't worn in a while, help decrease your risk of heart disease. I would love to help you get there. So again, give us a call at 614-442-2600 or visit www.prohealthservices.org today. If you like the information I shared, please be sure to subscribe, comment, and like. And we'll see you next time. Bye for now.